Anxiety is a popular word used by people. But what exactly is anxiety, and what do you need to know about anxiety? Hello, my name is Ayodele. I'm a community health extension worker here at ICA, and today I'll be telling you all you need to know about anxiety. Anxiety is the body's natural response to stress. It is a feeling of apprehension or fear of what is to come. So, when you have a job interview, or your first day at school, or you have to make a speech in public, that feeling of fear and apprehension you feel is anxiety. Anxiety can be unpleasant, but it motivates you to want to be better, to do better. Generally, anxiety comes and goes, but when anxiety interferes with your everyday life, when it is extreme, and when it lasts longer than 6 months, then you might just have an anxiety disorder. In the case of an anxiety disorder, it is intense, constant, and sometimes debilitating. It can stop you from doing things you normally enjoy. Normal things like receiving a phone call, crossing the road, and in extreme cases, even leaving your house. There are different types of anxiety disorder. There's panic disorder, which is characterized by panic attacks. There's also phobia, which is characterized by fear of a specific activity, object, or situation, e.g. hydrophobia, fear of water, and claustrophobia, fear of small spaces. There's also social anxiety disorder, which is the fear of being judged by people in a social setting or situation. Then post-traumatic stress disorder, which is the fear that follows a traumatic event, like being in an accident, being in a violent situation, or losing a loved one. Then obsessive compulsive disorder, which is a recurring irrational fear that often leads to repeated specific behavior. Obsessive compulsive disorder, OCD, is often used to describe people who like clean places, clean surfaces, or are organized. But that is not the case. OCD negatively impacts the life of people who deal with it. You have people who are compelled to wash their hands over 100 times a day, who are compelled to open and close doors. So OCD should not be trivialized. The main cause of anxiety is not known, but it is likely caused by a combination of genetic and environmental factors, as well as brain chemistry. Generally, symptoms of anxiety include increased heart rate, difficulty breathing, trouble concentrating, difficulty falling asleep, and restlessness. In extreme cases, it could present as nightmares and panic attacks. Anxiety can be managed through lifestyle changes. However, with anxiety disorder, treatment in the form of psychotherapy and medication is needed. Psychotherapy involves meeting with a psychologist to help learn tools and strategies that could be used to help cope with the disorder. While medication used to treat anxiety include antidepressants and sedatives. If you are constantly experiencing any of the symptoms I talked about, or you'd like to speak to a psychologist, please call the number on your screen and someone will be there to listen to you. If you found this video helpful, please subscribe to our channel, share with someone, like and leave a comment. Thank you. Bye.